A new study released shows type 2 diabetes is on the rise among all populations here in Manitoba. In the last decade, the number of children diagnosed with the disease has gone up 50%, and children living in First Nations communities are 25 times more likely to develop type 2 diabetes compared to other children in Manitoba.
I mean, the roots are racism. I believe that if you subject any population to what First Nations have lived through and the experiences they had, you would see the same outcome.
Lorraine McLeod, Associate Director of Diabetes Care and Research, says diabetes has been naively linked with lifestyle choices alone, and that thinking has left people with the illness blaming themselves while healthcare professionals fail to look for other solutions. Another key finding, McLeod says, was First Nations people are accessing primary care at a similar rate to all other Manitobans, but that care is not reducing the complications from type 2 diabetes, such as leg and foot amputations or kidney failure. McLeod says these high-risk healthcare conditions for First Nations people have been created by racist-designed public health policies.
I, as a nurse, have seen the evidence of racism. I've sat and listened and spoke up about it.
Dr. Chelsea Ruth, one of the study's co-leads, writes, there is this prevailing belief that First Nations individuals have more complications because they're not accessing health care. But this report actually shows they're receiving health care in the same numbers, but the care received is not adequate to fit their needs.
If you're a young person living with type 2 diabetes, we know that they have increased rates of mood and anxiety disorders.
Elizabeth Sellers is a child diabetes doctor and says we need to work collaboratively to develop programs to support youth and families that include appropriate mental health supports in partnership with First Nations communities. As young girls with diabetes today become pregnant later in life, Sellers says we could see diabetes cases rapidly increase.
And now we have a snowball effect where then babies are being exposed in utero, and that is clearly a very significant risk factor. If we're going to break that cycle, I think we need to look at supports for care and education in the communities.
According to the study, between 2011 and 2017, there were 2,283 infants born to women with type 2 diabetes in Manitoba, about half of which were born to First Nations women. In Winnipeg, Mark Neufeld, City News.